going back to diabetes and for the most part, diabetes, I mean, heart disease too, but I don't understand why there isn't more research on this that shows us that it is the fat in our cells. I mean,
yeah.
What is going on?
The disconnect is not that there's not research. There's a huge amount of research. The disconnect is between the research and public consciousness. And the reason I say that is we have been working with Yale University. Jerry Schulman and Kit Peterson are pioneers in this area. And Jerry Schulman just recently received the highest award that the American Diabetes Association can give. And what he has done is our patients go vegan here in Washington, D.C. They get on the Amtrak train and they go up to New Haven, Connecticut, and they go into an MR spectroscopy machine, and we measure the fat inside their cells. And you can see it. And so anyway, there have been many, many, many studies that have shown very, very clearly that the buildup of fat inside the muscle and liver cells is the whole reason insulin is not working. The problem is that it's much easier for people to say, it's got to be the sugar. Part of that is scapegoating. Again, I'm not saying sugar is health food. It's not. It's junk. You don't need it at all, and it is addictive, and it's particularly fattening if you bake it into a cookie with a lot of butter. But the reason I'm concerned about this is if people are only avoiding sugar, they're not tackling the disease in the way they really need to tackle it. And if the next generation is going to go up without diabetes, they got to do a whole lot more than skip the Coke. That's a good idea, but they need to go much further.
They skip fruit too, which they
like
shouldn't do.
The Diabetes Association doesn't talk about getting the pork chop off your plate.
You know, if you look at populations that follow vegan diets, I'm talking about, for example, among Seventh-day Adventists, which has been a wonderful natural experiment because their church teachings say follow a healthy diet. So for some, they're meat eaters, some they're fish eaters, some they're vegetarians or vegans. It's astounding. The more you get toward a vegan diet, the healthier the body mass index. I mean, you know, they're in a healthy body weight. And the difference in diabetes statistics between the people who have gone to a vegan diet versus the people sticking with meat, it's astounding. The vegans have very, very little diabetes. The meat eaters have a lot. So anyhow, our research team has shown that no matter how old you are, when you go toward this kind of way of eating, it can cause diabetes to improve. In some cases, it's just no longer there.
I mean, I hear of people going on the keto. Keto is high fat, right? And paleo is higher protein. Anyway, keto, paleo, and they do it to try and lower their blood sugars.
Yes, and you can sort of understand why. Because with a ketogenic diet, there's practically no carbohydrate in it. And let's say a person is very insulin resistant. Their cells are filled with fat. And at that point, if you just don't eat any bread at all and you don't eat any carbohydrates, your blood sugar isn't going to rise because you're not providing any glucose into the system. But that wasn't the cause of it.
They're not looking systemically is what you're saying.
They're not looking exactly.
Patching.
And once they introduce those foods, you can really see how insulin resistant they are.
Right. And so that convinces them that sugar was the problem. As soon as they had bread or sugar, their blood sugar went up through the roof. But what I say is, wait a minute, why can you not have a piece of fruit or some bread or some pasta? The problem is inside your cells. So we use a low-fat plant-based diet. And for the first couple of days, their blood sugar might rise a little bit because they're eating more carbs and their cells are filled with fat. But by about day 3 or 4 or 5, their blood sugar starts to turn and it starts going down and down and down. And if they're on medications, they need less and less and less. And by the way, I encourage people to work with their doctors because the doctor is going to need to back you off your medication at the right time, and which, of course, the patients love to get off their medications. But you want to do it. You want to do it smartly.
Is there something that they should be looking at then, rather or in addition to their A1C? The
A1C is a good measure of your blood sugar control, but everything else gets better with it. Look at the number on the scale. That's going to move. Your cholesterol is going to change. Your blood pressure will change. All these things get better. And as you said, Dotsie, for men, erectile dysfunction very often goes away. And it's the coolest thing to see these guys. They come into our studies. I remember years ago we were doing a study for late-stage diabetes, people who had neuropathic pain, meaning their nerves had been assaulted by this disease. And,
is that like fibromyalgia?
It's like your life. Sorry?
Is that fibromyalgia? The neuropathic pain?
No. Fibromyalgia is where you have pain in your muscles.
Oh, okay.
But For people who've had late-stage diabetes, their fingers tingle and hurt or go numb, and their feet hurt, and they can't feel things anymore, and it's just a miserable condition. So, but what we found is that a plant-based diet helps that too. And in the course of these studies, we have the guys around the room saying, "You wouldn't believe the surprise I had this morning."
Yay! Know what they're talking about.
We didn't tell them that was going to happen. And I'm not sure if that's good news or bad news for their wives, but this happens quite predictably.
Well, that's a very important point to make, because I think that's something that's not discussed, and erectile dysfunction is a more common than it should be in our country. It doesn't have to be that way. I want to talk about
Alexander, let me pick up on that point just real quick.
Yeah.
I am gonna let me go so far as to say that if a guy, he's 55 years old, he goes to the doctor and he says, "I'm having a little trouble with my nature," I'm going to say that if the doctor writes out a prescription for Viagra and leaves it at that doctor has just made a terrible mistake. Because a guy with erectile dysfunction in midlife, he doesn't just have narrowings in his in his private parts. He's got artery narrowings in his heart. He's got artery narrowings to his brain. He's at very, very high risk for stroke or heart attack. So what the doctor should say is, "I can give you some Viagra for tonight if you want. But let's talk about what you are eating. Let's make sure you crush out the cigarettes. Let's protect your blood vessels, and then hopefully you're not going to need the Viagra at all." But what you got to think about is the heart and the brain. That's what is being assaulted by this.
So basically the erect penis is the canary in the coal mine. Is that what you're saying?
That is exactly it.
Or the not erect penis. We got to talk about it directly, you guys. Can't shy away from it.